Pause.
Okay. Thank you guys for coming today. I just wanted to do a quick presentation for you, and thank you for taking some time out of your busy days. But so to start off, in a study done at the Clatterbridge Center for Oncology in Wirral, Merseyside, United Kingdom in 1999, of the 100 patients included in this study, all of whom had head and neck cancer and were receiving radiation treatment, 57% of these patients had experienced weight loss during their treatment. A mean or average weight loss of 6.5 kilograms, equating to approximately 10% of their body weight. So as we can see, the prevalence of this occurring is pretty high. So, some side effects of radiation to head and neck cancer. Radiation therapy to the head and neck causes a number of side effects which are unpleasant. Some side effects are temporary and will disappear after your treatment is complete. Other side effects could be permanent. The doctors and nurses will discuss the side effects in detail with the patients. Listed below are some side effects that are common with this type of treatment. You can experience thickened or lack of saliva or loss of taste, sore throat and hoarseness, and also some swallowing problems and subsequently weight loss. How we can manage these side effects. So for sore throat and mouth, you can start by eating some soft, specifically cold foods. For example, maybe some canned fruit, ice cream, popsicles, things like that. And you want to try to avoid acidic foods high in acid, such as citrus fruits. You can try some fruit juices that you enjoy the flavor of, just to try to increase your intake. For dry mouth from lack of saliva, you can try swallowing a small sip with each bite of your food. You could try some sugarless hard candy to maybe stimulate some saliva in your mouth, or eat moist foods. For example, you could try dunking your food maybe in some water or something before you take a bite. That might help also. If swallowing becomes difficult, you want to try to eat more liquids or pureed foods instead of actual hard foods themselves. Formula supplements such as Ensure, stuff like that, may be beneficial to try. And stay away from very thick or sticky foods such as peanut butter, because those are notoriously difficult to swallow for anybody. Let's see. So some dangers of not managing these side effects. So aspiration, or for the layman's terms, people always say something went down the wrong tube, is actually when there's an entry of material, such as either just secretions from your mouth, or food, or drink, or possibly stomach contents from your mouth, goes into the oropharynx or into the GI tract, into the larynx or your lower respiratory tract. So it can go into your trachea or into your lungs if it goes down the wrong tube. The portions, yes. So if aspiration occurs and you notice that you can cough, and that's not a big deal, but it can lead to aspiration pneumonia, especially in these patients that are affected with difficulty swallowing. So aspiration pneumonia is a lung infection that develops after you aspirate or inhale food or liquid, or possibly stomach contents or vomit into your lungs. You can also aspirate food or liquid from your stomach that backs up from your esophagus. So if you have a little GERD and it comes back up into your throat and you have difficulty swallowing, it can go into your trachea or your windpipe. So another possible solution for these people that have difficulty swallowing is if they're not able to maintain the nutrition that they need, they may need to get there's either temporary feeding tubes or there's more permanent feeding tubes. So there's three types of NG tubes, or nasogastric tubes. There's one that just goes into your nose and ends in your stomach. There's one that goes a little further than that. It goes into your nose and then ends in your duodenum. And there's one that goes a little bit further than that. It goes into your nose and ends in your jejunum. Those are a little bit less common. And this is just a picture showing where they might end up. So the NG just ends in your stomach. The ND, or nasoduodenal tube, will end in your duodenum, and then further than that is the jejunum, so that would be right over here in this area. And the more permanent tubes are the GJ tubes. The gastric tubes. So there's a gastrostomy tube, which is a surgical procedure where they go in through your abdomen. This is actually a picture of a Mickey button, which is basically the same thing as a gastrostomy tube. It just sits flush with the outside of the patient's skin so that you can access it temporarily, give them what they need, and then disconnect it so they can not have a big tube hanging out like a regular gastrostomy tube. There's also a jejunostomy tube, which again, it goes in through the stomach, but then the end of the tube actually ends in the jejunum. And there's also a gastrojejunostomy tube, which is a tube, it's one tube, but it has openings in the stomach and also openings in the jejunum. So there's a double lumen tube in there. So you can give food or nutritional supplements through the stomach, or give them all the way through the jejunum, and the doctor will give you the instruction on which one you need to use. So good nutrition. Maintaining good nutrition is important for everyone, but it's crucial to the person who has an illness or has weight loss. Your body is working extra hard to restore good health, and this increases your nutrient needs. The nutrients needed by the body for everybody include carbohydrates, protein, fat, vitamins, minerals, and water. The patient's doctor and or nutritionist, nurse will determine what type of tube feed will be the most beneficial to the patient. On average, the typical patient will need about 1,500 mLs of free water per day to meet their hydration needs. Part of that water can be in the tube feed itself. Part of that will also be needed to additionally on top of that. So in summary, just remember that these patients are going through an extremely difficult time in their lives. They are completely depending on us to help them get through it. So by making sure that they are as comfortable as possible, as well as meeting their daily nutritional needs, we're doing the best we can to help them fight this disease. So, thank you guys for coming.